Hey everyone, it's Sarah and Karina, and we're here to talk about Broca's aphasia. So what is Broca's aphasia? Sometimes Broca's aphasia is referred to as the disorder that makes you lose your words. It can be known as non-fluent aphasia, and people who suffer from this disorder have trouble speaking fluently, but their comprehension can be relatively preserved. The disorder impairs the expression and understanding of language, as well as reading and writing. Aphasia may co-occur with speech disorders, such as dysarthria or apraxia of speech, which also result from brain damage. So what causes Broca's aphasia? Aphasia is a disorder that results from damage to portions of the brain that are responsible for language. It usually occurs suddenly, often following a stroke or head injury, but it can develop slowly as the result of a brain tumor or progressive neurological disease. People with Broca's aphasia have damage that primarily affects the anterior portion of the left hemisphere. A stroke occurs when a brain blood clot or leaking blood vessel cuts off blood flow from part of the brain. Brain cells die when they do not receive their normal blood supply, which carries oxygen and other important nutrients. Other causes of brain injury are severe blows to the head, brain tumors, gunshot wounds, brain infections, and progressive neurological disorders such as Alzheimer's disease. People with Broca's aphasia. They often have right-sided weakness or paralysis of the arm and leg because the frontal lobe is important for motor movements. They also have a dominant feature called agrammatism, which is impaired syntax, or you can call it telegraphic speech. It is mostly content words, such as verbs or nouns, and has a lack of function words. So they may say something like, walk dog, when they are meaning, I will take the dog for a walk. Comprehension is usually mildly to moderately impaired, but can be within normal limits. People with Broca's aphasia. They may understand speech and know what they want to say, but they often speak in short phrases that are produced with great effort. Because of this, they are often aware of their difficulties and may become frustrated easily. In the following video, you will see a man with Broca's aphasia. His speech is characterized by extremely limited vocabulary, but has preserved the natural intonation in his speech. This clip demonstrates his intact comprehension and his limited expressive abilities.
However, we shall see how effective.
But tell me, why is it that you're moving, actually?
Tunnel.
Is it because the kids have grown and the house is getting too big, or ready for a smaller place? Seems reasonable. Less to keep up. Now, all your children are grown, right? How many children do you have? Can you count that out for me? All right. What number is this? Right. Now let's count it out.
1, 2, 3, 4.
Nice. Well, since you did 4 so well, let's go for broke. Let's go up to 20 if we can.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 1, 2,
Okay.
So how is Broca's aphasia diagnosed? Usually a physician will first treat the patient for his or her brain injury. Most patients will undergo an MRI and or a CT scan to confirm the presence of a brain injury and to identify the precise location, such as Broca's area, which is in the anterior left hemisphere. Knowing the site of lesion is important for a differential diagnosis, and it may show us the difficulties the patient may experience that is associated with that area of the brain. If the physician suspects aphasia, the patient will usually be referred to a speech-language pathologist who will perform a comprehensive evaluation. Once the speech-language pathologist has received a referral, they will perform a comprehensive evaluation of the patient's communicative abilities. First, they will collect the patient history. Then they will administer a comprehensive standardized test of language assessing 4 modalities: auditory comprehension, speech, reading, and writing. These standardized tests of language are used to classify a disorder, determine language and communication abilities, make a prognostic statement, and provide guidance for treatment. 2 widely used classification tests are the Western Aphasia Battery and the Boston Diagnostic Aphasia Examination. Another important part of the assessment is informal measures. The clinician should gather a conversational sample and assess the following areas: social communication, communication of basic needs, expression of ideas, and understanding a communicative partner. These areas are important for daily living activities, so it is important to note the overall effectiveness of their communication. Other areas of assessment that could help with therapy planning are orientation and memory, the patient's ability to auditorily comprehend, the patient's ability to answer yes/no questions, and their ability to comprehend sentences, read, and repeat. Following a brain injury, tremendous changes occur in the brain, which help it to recover. As a result, people with aphasia often see dramatic improvements in their language and communication abilities in the first few months, even without treatment. But in many cases, some aphasia remains following this initial recovery period. In these instances, speech-language therapy is used to help patients regain their ability to communicate. Research has shown that language and communication abilities can continue to improve for many years and are sometimes accompanied by new brain activity in tissue near the damaged area. Some of the factors that may influence the amount of improvement include the cause of the brain injury, the area of the brain that was damaged and its extent, and the age and health of the individual. Therefore, how aphasia is treated depends on a lot of different factors. So aphasia therapy mostly aims to improve a person's ability to communicate by helping him or her to use remaining language abilities, restore language abilities as much as possible, and learn other ways of communicating, such as gestures, pictures, or use of electronic devices, if the modalities are severe. Individual therapy focuses on the specific needs of the person, while group therapy offers the opportunity to use new communication skills in a small group setting. A speech-language pathologist may use many techniques for therapy. They may ask a patient to carry out simple tasks such as matching words to pictures, doing repetition tasks where the patient repeats what the clinician says, using melodic intonation therapy. For over 100 years, clinicians have noted that patients with non-fluent aphasia are capable of singing words that they cannot speak. Thus, the use of melody and rhythm has long been recommended for improving fluency. But it was not until 1973 that music-based treatment was developed. Melodic intonation therapy is a treatment that uses musical elements of speech to improve expressive language by capitalizing on preserved function and engaging language-capable regions in the undamaged right hemisphere. Some other techniques may involve working with a computer and working in group therapy with people with other aphasias or family members.
Give me my sweater. Give me my sweater. So, if you're looking for this, you can say, and carry my sweater. Give me my sweater.
A speech-language pathologist should be patient, listen, and communicate to individuals with Broca's aphasia. They should encourage individuals to practice learn techniques daily. They should educate and teach family members about Broca's aphasia, and they should individualize therapy to meet each patient's specific needs.
Additional things an SLP can encourage their patient to participate in are activities such as book clubs, technology groups, and art and drama clubs. These experiences can help patients regain their confidence and social self-esteem, in addition to improving their communication skills. Stroke clubs, regional support groups formed by people who have had a stroke, are available in most major cities. These clubs can help a person and his or her family adjust to the life changes that accompany stroke and aphasia. Thanks for listening.
Bye!